Good afternoon, everyone. This is Dr. Raymond Gasky at Bradford Family Chiropractic. I'm here with Jerica. She'll be demonstrating. We're going to be going over two very different but very specific exercises to do for an acute case of sciatica. So the first demonstration we're going to do is going to be for a case of sciatica that we believe is coming from Piriformis syndrome. Piriformis is a grouping of muscles in the posterior hip. So if our patient at present is having sciatic-like or nerve-like pain running down that right leg, we're going to be performing this piriformis stretch or exercise with a maneuver where we're going to cross over the involved leg. So Jerica, you can cross over. We're going to put that leg into the figure 4 position, and then we're going to demonstrate the exercise. What Jerica is going to do is she's going to slip her hands between her legs, and we're going to either bring that knee towards the chest with the assistance of the hands, and we're going to hold that for roughly 30 seconds, or we can do repetitive motions where we can bring that leg up, hold it for 5 seconds, 1, 2, 3, 4, 5, and then we're going to bring it down again, and we're going to repeat that maybe 5 to 10 times. We're hoping that this is going to help reduce some of the pain associated on that right leg, the right piriformis. If the pain was traveling down the left leg, we would just switch the legs over. Can you demonstrate that? This would be for a left case of sciatica. And let's try that one. We lift, we hold for 5 seconds, and then we release and repeat upwards of 10 times. Now, our second case of sciatica, if we believe it's coming from a form of a posterior disc, discs tend to generate or herniate towards the posterior aspect of the spine. So for this one, we're going to do what we call a Cobra position, or a somewhat of a reverse stretch than what we just did. So we're going to demonstrate this with Jerica, and this is kind of the baseline prone position, and some of our sciatic patients might not even be able to extend back whatsoever without pain. But what we hope is if there's any inability for her to extend back, to go up in a Cobra position. So demonstrate that Cobra position for us. This is the ideal position where we're going to have the patient do this for either 5 to 10 repetitions of 5 to 10 seconds, or we can just do a 30-second hold. If this is too painful, what we could do instead is incorporate with the patient. So let's go down into the full prone position again, Jerica. If that was too painful, we can give the patient either a pillow or a bolster, and we're going to put that underneath the torso, and we're going to have them hold on to that bolster, and slowly, as time goes by, add pillows to get that area extended out. Again, this is a prone push-up, another form of treatment for sciatica, most likely brought on by a disc herniation. Again, this is Dr. Raymond Gasky at Bradford Family Chiropractic, and Jerica saying goodbye. Thank you. Good job.
Awesome.
Whether